In 2025, the link between hormones and gut health had finally become one of the most talked about subjects in both medical and wellness circles. Experts had long suspected this connection, but advancements in technology, research, and our growing understanding of microbiomes had unveiled the profound relationship between what we eat, the bacteria in our gut, and how our hormones behave. Dr. Elena Ramirez, a researcher specializing in endocrinology and gut health, had always been fascinated by the way our bodies function as interconnected systems. A few years ago, she had stumbled upon a breakthrough study showing how the gut microbiome could influence hormone production and regulation. It was a concept that had been tossed around for decades, but now, with AI-powered research tools and microbiome sequencing at their disposal, scientists were finally able to map out the exact pathways between gut bacteria and hormones. For years, the medical community had known that hormones like cortisol, insulin, and estrogen played a role in digestion, but the new findings were mind-blowing. The gut wasn't just responding to hormones, it was actively contributing to their regulation. Dr. Ramirez's favorite example was the relationship between gut bacteria and serotonin, the neurotransmitter often referred to as the happiness hormone. It turned out that about 90% of serotonin was actually produced in the gut, not the brain. When patients came in complaining of anxiety or depression, Dr. Ramirez didn't just look at their serotonin levels in the blood, she took a deeper look at their gut health. Her patients who had imbalanced gut bacteria often had lower serotonin production, leading to mood disruptions. But it didn't stop there. Hormones tied to the stress response, like cortisol, also had a direct impact on gut health. Dr. Ramirez had noticed a pattern in her clinic. Patients with chronic stress had altered gut microbiomes. High cortisol levels seemed to promote the growth of harmful bacteria, leading to digestive issues like bloating, gas, and even leaky gut syndrome. In return, an unhealthy gut could worsen stress responses, creating a vicious cycle. In 2025, the treatment of gut health had evolved. Instead of just prescribing antidepressants or anti-anxiety medications, Dr. Ramirez and her colleagues were now working with nutritionists, psychologists, and even gastroenterologists to develop integrated treatment plans. Their approach was holistic, focusing not only on the brain or hormones in isolation but on the gut as a key player in the hormonal balance. For example, patients were encouraged to eat foods that nourished their microbiome, like fiber-rich vegetables, fermented foods, and prebiotics. Gut healing supplements, including probiotics and specialized enzymes, were now a standard part of the treatment protocol. Patients were also learning about the importance of managing stress through meditation, exercise, and proper sleep, factors that directly impacted cortisol and overall gut function. Yet, it wasn't just patients who benefited from this new way of thinking. The general public, armed with apps and personalized health data, could track how their diets, sleep patterns, and stress levels affected their hormones and gut health. Many people were now taking preventative measures, tweaking their lifestyles based on data about their unique microbiomes. In 2025, it was clear that the future of healthcare wasn't just about pills and prescriptions. It was about understanding and optimizing the delicate balance between our gut health and hormones, using data, technology, and a more comprehensive approach to healing the body from the inside out. Dr. Ramirez stood in her lab one evening, staring at a display of patient results. She smiled, knowing that the world had finally caught up with the realization that true health could only come from embracing the interconnectedness of all systems within us, including the gut and the hormones it helped regulate. And with that, she knew the future of medicine had never been more exciting.